Hello, my name is Veronica Sierra. I'm a licensed dietitian, and today we're going to talk about the benefits of omega-3 in ADHD. ADHD is known as Attention Deficit Hyperactivity Disorder, and it's characterized by inattention, impulsivity, hyperactivity, and it can occur mainly in children, but also it's present in teens and adults. The causes can be several, such as or deficiency in certain neurotransmitters. It is seen in between 3 to 5% of school-age population, but also many adults can present it. It is twice as likely to occur in boys than in girls. Some of the principal symptoms can be inattention, such as careless mistakes and lack of attention. The kid seems not to listen. They have difficulty organizing tasks and activities. They usually fail to follow through instruction. They can get easily distracted, lose things, or sometimes they are reluctant to participate in tasks requiring mental effort. Not all kids present the hyperactivity part, but some of them do. These kids might fidget or tap with hands and feet, screams on seats, and they can also talk excessively. They seem to always be on the go. Usually, they are unable to participate in leisure activities quietly because they cannot wait for their turn and they blurt out answers before some questions have been asked. These kids can be running or climbing even in inappropriate places. Children with ADHD can have difficulty on different areas, such as concentrating on tasks, knowing where to start a task, or get lost in directions. In ADHD, one or more of the attention processes can be altered, such as focus, that means picking something to pay attention to. Selection, that can be pick something that needs attention at that time. Sustain, which means pay attention for as long as needed. Resist, avoid things that remove our attention from where it needs to be. Or shift, that means move our attention to something else when needed. These symptoms have to be diagnosed by a pediatrician or a mental health professional, and 6 or more of these symptoms might need to be identified in children aged 4 to 17 years old, and children older than 17 will have 5 or more. These symptoms must begin before the child reaches age 12. They will need to be continuing for more than 6 months, and they need to be occurring in more than 2 settings, such as home, school, or social situation. Also, it's important to see if they're causing some impairment. Usually, these kids have a lot of conflicts at home because they fight a lot with their siblings and they tend not to listen to their parents. Usually, they are very disrupting. They throw big tantrums and they are unable to calm down. Usually, they don't follow instructions and it's hard for them to start their task and to finish them on time. Also at school, they can start having problems. Usually, they are unable to start or keep focus on a task. They don't follow instructions. They usually don't complete the work, and they miss the days to turn in things because of distraction, and they have problems keeping seated and have disruptive behaviors. In the social setting, they have difficulties making friends and to be participating appropriately in social activities. Also, with teachers, they have plenty of conflicts because some of them, as I mentioned before, they cannot stay seated, they blurt out questions, they do disrupting noises, so teachers don't like them very much. And many teachers, they don't know how to handle these situations properly. So these kids start having low self-esteem and feelings of inability and social rejection. When do you need to seek for professional help for your child? Mainly when these behaviors are interfering with their daily functioning, when you're having problems at home or they are facing struggles at school or with peers, when they are presenting difficulty in sports or recreational activities, and also when you are seeing or acknowledging some of these inattention, hyperactivity, or impulsivity behaviors. As I mentioned, the diagnosis needs to be done by a pediatrician or mental health professional, and we need to work on these support strategies, such as identifying their priority areas of concern, also to see how your child is functioning and how this is affected to help reduce and manage their challenges. Behavioral and cognitive therapy might be very useful, and also to have daily structured activities or tasks, and to try to give your kids short instructions that they can follow through. And very important is to reinforce positive behavior. This will help your kid to start developing certain skills and to start improving and feeling adequate. Effective discipline strategies are also very important, and a support of a psychologist or counselor at school might be very useful. The main treatment for this syndrome is the stimulant medication, and its main benefit is that increases hormones such as dopamine and norepinephrine. It also helps to improve concentration and decrease fatigue. And there's several compounds that are known as stimulants, such as amphetamines, methamphetamines, and methylphenidate. But not all the kids can tolerate the stimulant medications. So there are other treatments such as non-stimulants. These ones also affect the neurotransmitters, but they don't increase dopamine. They tend to take longer to see the results than with stimulants, but they might be used when stimulants aren't safe or are ineffective for your kid. Avoiding side effects of stimulants is important because they can be very disruptive for their life. So this can be an option. Some of the side effects that I mentioned are irritability, mood swings, certain problems sleeping, decrease of appetite, nausea, indigestion, stomach pain, and vomiting. And this can be very disruptive because these kids can be feeling stomach pain for the whole day. They don't want to eat, and they will have troubles with their growth and will start losing weight. So it's very important to be very vigilant about these symptoms. And also these kids might have high potential for abuse and dependence, and also it can interfere with their blood pressure or heart health. So it's very important to keep monitoring your child and all these side effects. Okay, so why omega-3s are so important for the brain? 60% of your brain is composed of fat. It depends essentially on these essential fatty acids that are the building blocks for the neuroconnection or the neurotransmission. The main supply of this omega-3 are fatty fish and fish oil, known as EPA and DHA. They help also to support your emotions, and also they will protect the brain from low-grade inflammation. What's the connection of omega-3 and ADHD? It has been observed that when the kids have fewer omega-3s, they are in higher risk to present ADHD symptoms. They also have made some studies with ADHD children, and they have observed that they have low levels of these omega-3s. Low levels of DHAs, which is the most important omega-3s for the brain, show that these kids present more defiance, hostility, mood swings, and learning difficulties. Also, they have observed that low levels of DHA can have some disorderly brain that it's linked to the symptoms of the ADHD. Which are the benefits of omega-3? It eases hyperactivity. It helps with inattention, disobedience, and hostility. And also these kids start showing better memory and better learning, and also improve their sleep. Dietary lifestyle guidelines are very important to manage for these kids, because if they have a healthier diet and they get the nutrients they need, their symptoms might significantly improve. Reduced sugar intake is critical, such as sodas, juices, cookies, and ice cream, because remember, sugar is a pro-inflammatory substance, and this can trigger some of the disruptive behavior. It's important to teach this kid to eat vegetables, legumes, and fruits, because they're packed with these phytonutrients, fiber, and good nutrients for the brain. Reduce the amount of processed foods, coloring, additives, or preservatives, because they can also be very inflammatory for the brain. Increase the intake of protein and fatty fish. Try to avoid gluten, because gluten can also be a neurotoxin. Increase the intake of omega-3 with a supplement rich in EPA and DHA. And also choose a good multinutrient along with exercise. Omega-3 and DHA, as I mentioned, is one of the most important nutrients for the brain, because it participates in many key functions, and it's also the only nutrient that can cross the blood-brain barrier. It's a potent anti-inflammatory. It also helps signaling pathway and synapses of the neurons. It helps with cell survival. It improves moods, and also it helps with cognition and memory, which is so needed for these kids. There's a ratio called omega-3 6:3 ratio, and this means that for every 3 omega-6 that you have, you need to have 1 omega-3. And this is very important because, as you can see in this image, omega-6 are pro-inflammatory and the omega-3s are anti-inflammatory. And besides many bodily functions that this ratio will help us with ADHD, this is also very important to reduce inflammation of the brain. We can rely on some nutraceuticals, which refers to some nutrients or supplements from the food that will have a positive effect on health, such as antioxidant will improve cellular energy, cardiovascular health, digestion and absorption of nutrients, and improve metabolism. Also, elasticity and resistance of many tissues, organs, and skin for our osteoarticular health, and will prevent chronic diseases. So again, in children with ADHD or even adults, all these nutrients will benefit the condition. So we have this unique formula of omega-3s that it's called the balance oil. It can be liquid or it can be presented as a capsule, such as the Ascent. And we also have a vegan option, which comes from algae, such as an aqua, that it's very suitable for people without gallbladder. So the main benefit of this product is that it will provide a good amount of omega-3, such as EPA, DHA, and DPA, but also polyphenols, which are potent antioxidants that will help as a carrier of the oil to the cell. Vitamin D is also a liposoluble vitamin, which need the fat to be absorbed, and also have many benefits on the brain. So these 3 compounds, the omegas, the polyphenols, and vitamin D, will work synergistically to give the people with ADHD all the benefits for the brain. We also have a test that it's called the balance test, and this will help to know which is your omega-3 to 1 ratio and will determine your level of inflammation. Viva is also a good product for these kids because it will help them to have a good night's sleep. It's also very relaxing for the mind and to manage emotions. So we have already mentioned that these kids tends to have a lot of negative emotion, low self-esteem, sometimes anxiety or depression. So this might be a very good option for them to add to their diet. Extend is also a multi-immune food supplement that will help us get all the vitamins and minerals that are needed, but also it contributes with the immune system because it has a specific compound called 1,2,3 beta-glucans. And this is going to help the immune system and the digestive health. So this is very important to keep in these kids, because remember, what happens in the gut affects directly to the brain. So we have this health protocol that it's the combination of these different products, such as the Xenobiotic that will help restore the gut, the balanced soil that we already mentioned that will help reduce inflammation, but it's the key nutrients for the brain, the Extend that will give all the vitamins and minerals necessarily, and the Viva that will help manage emotions. Since Xeno products are very safe, they are approved by the EFSA, that is the European Food Safety and Authority, and they're very clean, they are organic, so you can see all the benefits that you can get from this protocol. Thank you very much.